Hello, Dr. Garrison. Thank you so much for taking time out of your busy schedule to chat with us about how shifting perspective can improve stress management. Would you like to share with us about the work you do at Morehouse School of Medicine?
Yes, I would. So
Thank you.
I am Shawn Garrison, clinical psychologist, PhD, ABEP, which means there's a national certification that I had to do very recently, which is why I'm mentioning it. I've been at Morehouse School of Medicine for 33 years. So I started here when the school was about 15 years old or so, I'd say. My primary job is Director of Counseling Services. So across all of those years, I have watched programs begin and develop and flourish. The MD program and MPH program was here when I got here. So my job and that of my team is to serve the counseling and psychotherapy and wellness needs of our students, you and me, undergrad medical education. I also do a half-day clinic at Morehouse Healthcare, where I serve the general population of Atlanta, and just finished as of December, worked 10 years with Grady, a half-day clinic there in the oncology, the Georgia Cancer Center as a psychologist. I also teach in the psychiatry department. I have assistant professor in psychiatry. So I teach the psych residents cognitive behavior therapy, and I do some supervision.
Wow, that is so impressive. Yes, that was very impressive. And it seems like you've been at Morehouse a very long time and done some great work here. And it is great to have allies with your expertise as we focus on Mental Health Awareness Month. Even though we focus on this topic during this month, the information is applicable 365 days a year. I'm going to turn this over to Phoebe Nams. She's going to join us in this conversation as we chat about the valuable lever for managing stress. Phoebe Nams is the Associate Program Director here at Hybrid Solutions.
Welcome.
Thank you. So we're really, as Selena said, so very thankful that you took the time to share with us, because this was a very intriguing topic for me, and I did a little research, but I still feel like I just don't know that much. So maybe you could help us out by really explaining, when you say perspective shift, what exactly do you mean by perspective?
Actually, I think a better word would be perception. If I say a perspective, that might have been a little misleading. So perception, because we are in charge of how we perceive something. So the cognitive behavior therapist in me, and let me take a minute, because there are many people who are listening who know about CBT. There are folk who are listening to see what it is that we say here that doesn't apply. And so what I want to preface all of my comments with is there is not one size fits all approach to human beings, to the situations they find themselves in. There really isn't even one definition of happiness or joy, or even to some extent, mental health. Mental health and mental illness, wellness, and the lack thereof is on a continuum. So there isn't a point at which we are mentally healthy and then you go 2 inches to the left. Oh, now I'm not. That's not how it goes with physical health or any of those things. So just let me say that first. So I don't do CBT the way it is done now. It's when I was in school in a whole nother century. So the basic premise of CBT therapist, and I am not just a CBT therapist, but this is the part that makes sense to me. How we feel, what our emotional reactions are to anything is not based on the thing, is not based on what happened. It is based on how you perceive, how you define, what you believe about what happened. So, does that make sense? You follow? You look like you're thinking
absolutely. About no, okay. Absolutely. It's not the thing. It's the story we make up about the thing.
Absolutely, because we all make up stories. As a matter of fact, one of the ways I talk about shifting perception is the 4 Agreements by Don Miguel Ruiz. And one of the things he says is one of the things that human beings have always been spectacular with, and that does separate us in some ways from the other animals and mammals, higher order included, are the fact that we can tell stories, that we tell stories to explain the world to us, to ourselves. So it's not a bad thing at all. It is a thing that we do. So a shift in perception says that now you can change your perspective. The other thing that makes sense to me about CBT is the idea, and I am kind of repeating myself, that our emotional reactions are born from what we think, are born from what we believe. So there isn't some external little anti-Cupid thing flying around shooting all kinds of emotional arrows in your head. It all happens internally.
So that means that there would also be a measure of elasticity and an ability to influence our beliefs, no?
You have the ability to influence your beliefs because that's how we're built. The elasticity is something that you would want to, on purpose, decide to engage in developing. There, but I think you have to develop it, and you have to practice it, just like you'd have to practice anything else. Many of us like to believe that we feel a certain way because it just is, and there's nothing we can do about it.
That's disempowering, though, isn't it?
That's disempowering, and it is our choice, our prerogative, if we choose to see things that way. But the truth of it is, you can't change things outside of you, but you can change how you perceive those things that are happening to you.
Wonderful. So this leads me to wonder, can you give us an example, something maybe you've observed or, I don't know, achieved yourself as far as a, let's say, perception shift? We're going to change that word from perspective to perception shift. An example of a perception shift that had a powerful impact on somebody's life or in how they showed up in the world.
I mean, I'm a therapist. That happens just about every day that I do therapy with anybody. When we think about the social justice issues here in our country, and as people of color, we look at what happens to other people of color, men especially, getting killed left and right. And we think about that generationally, and we go, oh, we could say there's nothing to do about this. This systemic system has been in place for forever, and it's still doing the things it does. And so we always will know what will happen. We could think that, right? We could also think, so there's some parts of what's happening in the United States of America I don't have control over. And so then the question gets to be, of the things I have control over, what will I choose to pay the most attention to? I think I was talking to some chief residents. I'm not sure what that was, but they needed to show up, brand new chief residents, and they're gonna be responsible for continuing their own training and also to train and guide those residents below them. And one said, oh my goodness, I am really bad at scheduling things, and now I have to be available all the time, and I'm really bad at being available all the time. When I have my downtime, I need to be down, and I think I'm going to really mess this up because I don't show up like that. And so what we looked at was, what was her definition of what she was supposed to be doing, and was that a realistic definition? So the thing is, are you supposed to be available 24/7? And they said to me, yes, absolutely. That's the truth of it, because our medical training model is abusive. But I said that may be some parts of the expectation, but what parts of that is actually reasonable and manageable and doable, rooted in reality? So let's see what's actually possible. And then she started thinking, oh, yeah, I guess maybe people aren't always available. Like maybe every now and then a resident might not get the phone immediately as it rings the first time. I'm like, yeah. And so that's a human being thing. So if we shift the definition of the problem is not that that resident is just broken and is an irresponsible person who just shows up this way and there's nothing she can do about it. But if she's not broken, if she has managed to move through all of her academic endeavors to the point where she is now chief resident, you've done something right. So you're not broken. And so if you're not broken, now how do you define what the problem is? And so that's my definition of a shift. Was that helpful?
Oh, that is fabulous. Yes, that's absolutely fabulous, because again, I just keep seeing this theme as you're talking, that one perception makes you feel hopeless. The other perception, oh, I'm empowered to look at this in a new way.
Right. And feeling empowered doesn't mean it's going to be totally okay.
Easy or easy.
It doesn't mean that sometimes you are not helpless, you are, but now the problem is defined differently. But let me throw a wrench in this though, especially using from thinking about cognitive behavior theory. So if you listen to what we're saying so far, it sounds like, well, positive thinking is the way to go. You look at something, you go, well, I'm not broken. I can figure this out differently. Except we all know that positive thinking doesn't always work. We can wake up in the morning, okay, it's a good day. It's gonna be a good day, and it's still a crap day. So one of the ways to understand this is to think about human beings thinking. Human beings have a thought process on more than one level of consciousness at a time.
Oh,
we think
explain that.
We think our conscious thoughts, like I can go, okay, great, I'm just here. I'm in this meeting and somebody is really making me angry. Ooh. I can be aware of that thought. But then there's also a subconscious thought that says, everybody in this room doesn't respect me. They all think I'm just silly, stupid. And then the other level of thinking is unconscious, and that's dreams and, hypnosis. That's not available to us during the day, but that conscious and subconscious thinking is what human beings do all day long. So we have a constant stream simultaneously. Here's another example that I use with everybody that I explain this to. So let's say, I'm still trying to wear my lovely high heel shoes, and I'm walking across the plaza from the parking deck to the door.
With the cobbled
things, and I trip. So my conscious thought is, oh, I hope nobody saw that. But that subconscious thought, the one that is also available to me, but I don't really pay that much attention to it, that one could be, I hope nobody saw that. And then immediately, you're so clumsy. You're so clumsy. Now,
self-judgment.
That subconscious level, Aaron Beck, who is the one in the 60s who developed cognitive behavior therapy, he's a psychiatrist actually, and began to look at this process and phenomenon in human beings and does a lot of research on that. I think he really just recently passed at like 90 some years old. So he looked at all this and thought, what's happening? So he did verify that there are two streams of consciousness going on, our conscious thoughts and subconscious ones, and we are available to both of them. That middle level, the subconscious, we're not really checking for it. So what happens is we don't correct those thoughts. We can correct those conscious thoughts. We don't correct the subconscious ones, so they get to stay pretty much unchanged, but they do the same thing that our conscious thoughts do in terms of creating an emotional state or reaction.
Sometimes more powerfully than the conscious thought?
See, there you go. Smart woman that you are. Absolutely. Because if we're not really checking for that and we don't upgrade it, then we've been practicing it the exact same way, probably for years, maybe decades.
Oh, so how do we get access to this?
That's what therapy is about.
Ah!
However, in my example of, okay, I'm tripping, I trip and go, "Oh, but you're so clumsy." Maybe "you're so clumsy" happened when I was 12 years old. And my mother said, "Oh, you're so clumsy." And I thought, wow, she's right, I am clumsy. And that maybe that makes me feel anxious. So if I'm aware that that's the process, and I can go, "Oh, you know what, I'm feeling really anxious now. Let me stop and pay attention to what else is going on." What if I have on these high heels because I'm going to go make a presentation somewhere and I'm anxious about it? If I don't check that, then I will probably act as if that sentence is true, and maybe I'll drop my keys at the door or something. So it is just important to know that sometimes when I'm really working on this and I still have this feeling anyway, it's because you have these conscious thoughts, but then there's this subconscious, not unconscious, and you want to stop and say, so what historically does this mean? Like, what is this pulling off me? Why is this always the problem for me? Because human beings are very logical. We may think we're looking crazy, but we're very logical. So if we're doing something in the present,
Look for the root cause. You say there's a root cause for our behavior.
so somewhere in your life, it made sense. Now,
Yeah.
maybe you didn't upgrade, and so you keep doing the same thing, but somewhere it made sense. That's another variation on you're not broken. So if you're doing something that looks really kind of stupid or crazy, you can go, am I 100% totally stupid, crazy person? No. So somewhere this behavior made sense. And if you can take that burden off of you, like, okay, so I'm not broken. So now I know I have what I need to figure this out. And sometimes we can figure it out. Sometimes we need to talk to a trusted friend. Sometimes we need to go to a therapist.
So you're saying that pretty much there are steps to follow to get access to this, and part of it is therapy, but then part of it is just being more self-aware.
Part of it is being more self-aware and to recognize. Now, I told you that what we think determines how we feel, whatever the emotional state is we have. Okay, so I know this is also weird for lots of people, but we have a, generally speaking, right brain and left brain. The right brain is, Gestalt and all the art stuff. I have a daughter that's going into art therapy, so she's putting those two together. Left brain is the thinking, and we have the limbic system is deep in the brain that deals with emotions. So the truth of it is that's how everybody's brain is built.
Do they call that the primitive brain?
Actually, the reptilian brain is that bottom part where it just keeps your heart pumping and blood and then that middle part that includes the limbic system is the mammalian brain, that part of the brain that makes sure that we stay in connection, because human beings are pack animals. We do not do well or thrive in isolation. We literally have to have the connection. We literally have in our brains things called mirror neurons because we have to mirror what's going on. So that's the mammalian brain. And then these frontal lobes up in here, the prefrontal cortex, where we do all of our best thinking and we're so terribly, that's the newest part of our brain, and it's just 1/3 of our brain. 2/3 of our brain is instinctual.
Wow.
So if you're thinking, you're feeling all the time. If you are feeling something, you are thinking. So our emotions are pieces of information like our thoughts are, like the information we get, the stimuli we get from the environment, that it's another piece of information. And if your emotions are saying, hey, something is wrong, you should stop and go, wow, it may be my perception somewhere. Not that, or maybe the emotion is correct and you are feeling angry because someone is really attacking you, actually. But you have to, it's one piece of the information, and then your rational mind just helps you decide what to do about it.
But, okay. So it's like the emotions can be this powerful feedback mechanism, a way to interpret what input is coming at you, and then you use the executive function to decide, okay, this is how I need to respond to this to have the outcome I want. But if you don't go through that process, then you just react instinctually, habitually.
you don't pay attention to what your emotions are telling you, you just are missing about 50% of the information you need in this environment, this predicament to define the problem, know what to do.
So that's powerful. You're missing 50% if you don't pay attention.
Okay.
How do we pay attention then?
A therapist, maybe, some other professional would maybe have a different percentage on that. But I think of it this way. Our emotions we can think of them sometimes as nerve endings. They give you information. Yes, this feels good. No, this feels bad. Yes, this is hot. This is cold. So if you cannot register sensation, that means you can't register pain. And if you have an ingrown toenail, anybody who's had any kind of workshop or classmate has heard this before. If you have an ingrown toenail, you don't know that it's a real problem because it doesn't hurt. You could look at the toe and go, oh, that looks kind of red or looks kind of puffy. Oh, but it doesn't hurt, so I'm moving on along. You could go so far as to put yourself in real danger because ingrown toenails can get infected. So emotions are simply to say, hey, look at this, something is going on and you need to do something. People misunderstand that emotions should be paid attention to. They think that emotions make life unmanageable or dangerous, and that's not true. What we decide with our rational mind that we want to do about the emotion and what's make things dangerous. If I'm in a meeting and somebody is just really coming at me and I'm very angry about that, I need to say, somebody's really, that doesn't mean I need to pull out a Uzi and start shooting people, but I might be angry, so I have to decide what is the best approach to this. If I don't pay attention to the anger and I know something is wrong, but I'm not really paying attention because I don't want to acknowledge that maybe this person is not somebody I can trust, then I'm not even thinking very clearly. I'm way too busy trying to ignore something.
And what causes people to work so hard to ignore things that seem obvious on the surface? Is it fear? Is it
I don't know.
Habit?
Okay, so now you're asking very good questions because there's another part to this that I have known for a good while, but recently, like I guess last, I don't know, BC, before COVID, a couple of years ago, am very clear about, especially for people in populations of color. Trauma, when we deal with trauma, that is not a talk therapy thing, not in the beginning. There is a seminal book called The Body Keeps the Score, and everybody knows about that book. And another
Gabor
book,
Mate? No.
Van der Kolk. The Body Keeps the Score is by Bessel van der Kolk.
Oh.
And My Grandmother's Hands is written by a man of color, Resma Menike, I think, who has done trauma work. So, but for this conversation, the point is that your body holds your trauma. You are reminded, trauma is different from abuse in that the trauma response is because you think you might not make it through this situation. Your response to abuse is, I'm probably going to get really beat up, but maybe I can get out of this, maybe I can't, which is also upsetting enough. Trauma is a process. So when you're saying, why don't people notice things? That's the other part of it, which is there are triggers. I think we said this earlier. Each individual is the summation of all the experiences they've had so far. We're the intersect of everything that's happened to us. So I have my specific experiences. And so some statement or situation or environment may mean something to me. It pulls up something to me. It might not pull it up in you because we don't have the same experiences. Yet people of color do have a lot of very important things that are
aligned,
shared. So why people don't see something is for a lot of reasons. It may be some trauma response. It may be some triggers. It may be that they have been taught to not pay attention to their emotions. It may be that they are understanding on some level that I can change, but the change would be big and hard and maybe scary. Some people feel comfortable when they are in control, that is, I feel like I know what's going to happen next. And so, the stinky that I'm familiar with is better for me than a stinky that I don't know. It could be something like that. But we want to, you're carrying me into this conversation, but deep into human being and perception and therapy. I do want to say that if I pull it back, so for people who want to know how to be less stressed in the day.
Thank you.
I love this. We could have a whole conversation. We could go all the way into trauma response. Is truly to say, what part of this do I have any control over? What part of what's going on with me do I have some influence over? And
one of the questions we had was, how do we identify the areas where, if we have a shift in our perception, could it make the greatest impact for us? How do we kind of identify, something like that, so that we can manage our stress more effectively?
I think that comes with practice, but I think that you learn how to approach situations such that you pay attention to what you can manage, so that the stress is not out of control. You change yourself first, and then the change in stress comes after that. So I was going to talk about 3 different ways to kind of shift the perspective. We've talked about one of them, which is a CBT, in that you want to look at a situation, look at whatever your emotional reaction is, and go, okay, what's my conscious thought? What might be that subconscious thought? Where do I need to change my thinking so that this can be a solvable problem? Like, okay, no, chief resident, you don't have to be like every other chief resident, because everybody has something they do really well and some things they don't do well. So change the expectation you have of yourself. The other one is about the 4 agreements from Don Miguel Ruiz. He comes from a spiritual tradition, ancient Toltec, which is Aztec, Indian, Mexican, from a long time ago. He comes from a family of spiritual healers, but he chose to not do that and come to the United States of America and become a surgeon, I think a neurosurgeon. He had an event in his life that required him to go back and finish his training in the spiritual realm of things. So this guy's putting these things together. This is not a religion. And he just simply has 4 agreements that you make with yourself in any situation. The agreements are, I need to make sure I'm getting this, because sometimes I mess them up. The first one is be impeccable with your word. That doesn't mean only don't lie. Impeccability means without sin. And in this tradition, speaking against the self is a big sin, because the self is the intersect between the transcendent and the earth. So to me, this is very important, being impeccable with your word means you deal with what actually happened. You hold yourself accountable, but you do not blame or judge. You know how you said immediately when I said, oh, I tripped, you're so clumsy. You said, oh, that's a self-judgment. And you knew right away, that's not a good thing. We do that to ourselves all the time. So Don Miguel says, justice is paying for a mistake once. True injustice is paying for that same mistake over and over and over again. We know that society does that to us, but we mostly do it to ourselves as well. So hold yourself accountable for what may have gone wrong, your part of it, but don't judge or blame, because that gets back to, oh, you must be broken somehow. And then what can you do? So one thing is be impeccable with your word. The other one is don't take anything personally. Now, how weird is that? But don't take anything personally means other people are doing what they need to do because of their story. You just happen to be in it for a minute. So oftentimes what you get from other people is not so much about you, but about them. And then the third one, of course, is don't make assumptions, which flips that around. You have a story too. And everybody else is just, what is that, a squirrel in your story trying to get a nut. That so possibly You might want to think about that. The thing to do with don't make assumptions is you need to clarify. Everything is not about me. Everything is not about you. But if you're wanting to interact with someone, you clarify, because we all have our stories. That's what human beings do. But if you're trying to be impeccable with your word and speak just what's actually happening without judgment or blame, to not take it personally. This person's doing something really crazy. I wonder what's going on. Let me ask. This is what I'm thinking, what's really happening. And then the last one is do your best. And to me, this is so important, especially for our faculty, staff, and students and learners here. Do your best means in the moment you're given. Trying to do more than your best is the opposite of doing your best. Doing your best means staying realistic with what you're able to do right now. So if you think that you're supposed to give 125% to something, that is actually crazy. That is actually psychotic, because we only have all that we have. We only have 100%. You can't do more than 100%. That's everything, right? So if you think that you're giving more than is there, I wonder, what does that mean? It's not a good thing. It's where you begin to be abusive to yourself. Like that chief resident, I got to be available all of the time. So there's no time for her to be okay if she has to go to the bathroom or take a shower or, So does that make sense to y'all?
Absolutely. It's like avoiding the trap of perfectionism.
Yes. You keep leading me down this rabbit hole. So
I'm sorry.
Perfection is a fear-driven endeavor. When we want to be perfect, we're not trying to reach our best. We're trying to avoid anything that's wrong or a mistake. So you're mostly focused on what you don't want, not what you want with perfection. And I'm not going to say anything else about that. Because the last one is really helpful. Dr. Edith Fresh, who used to be in our psychiatry department, I think she still has a private practice, but she was a part of Morehouse School of Medicine for a very long time. She phrased this in terms of preferences versus expectations. So to decrease your stress during the day, you need to be aware of what it is that you can prefer versus what you can expect.
Can you expand on that a little bit?
Yeah, here's my team. I expect everybody to do so and so, such. How much control do you have over somebody else to make them be a way that you need to be? Anything from your skin out, you don't have control over that. You might have some influence, but you don't have control. So you can expect things of yourself. You have control over what you do. Everything else probably ought to be a preference. I would prefer people tell me the truth. I would prefer people show up and be ready to work. I would prefer people not be, undermined. I would prefer these things. But what happens if you show up with a preference for someone else's behavior and not an expectation? If you have a preference, then your adult grown-up mind can click in and realize when that's not happening. And then you are more in problem-solving mode rather than personally affront mode or angry mode, or something. The earth has gone off its axis because this person is doing the wrong thing.
Like my mom always say, you can only control your actions, not others. So it is
control your
actions. Yep, so
if you prefer that somebody act a certain way, you're more willing to ask a question. Why did you do that? Or what's going on? Or at least but the expectation makes a person pretty rigid, and also sets you up, just like taking things personally, just like pretending that your emotions don't matter. It sets you up for disappointment, for stress, for actually feeling out of control, for anger. All of those things do not help you approach yourself with some compassion and respect, and approach others with compassion and respect.
thank you so much. This has been some great dialogue, and I'm going to take some notes and apply it in my everyday life, because For me, I had to shift my perspective or perception on Mondays. Something about Mondays will stress me out.
Mhm.
And so I had to change that perspective. One, be grateful that I have a job to go to on Mondays. That's one. So,
So,
um,
for me, for things like that, I can say, I don't actually have, if Monday is so awful, I don't actually have to go to work. There are consequences to that, but I don't have, like, I'm not going to be put in jail until if I don't go to work, because a lot of the things that also make us feel stressed is that we feel trapped.
right.
And that if you can see it in some other way, but then what we were saying earlier, but there may be some historical thing about Mondays for you. There may be some automatic thought. There may be some trauma way back in the back when you were like, I don't know, in high school or something, and just didn't upgrade what a Monday meant.
Right.
And so any of the things that we've talked about will be helpful. And the very first thing you said is, okay, well, so let me stop and say, I'm not getting beat up by Mondays. Well, Mondays are kind of beating me up, but there's something else that's happening too.
Mhm.
I got a job. I can go do these other things. This is the basic thing is human beings have a right, a sovereign right to choose where they put their attention.
Mhm.
We choose what we attend to. And that's the point of meditation, actually, is to help you learn how to attend to one thing and not another.
Now that you're mentioning meditation, that's very important. It kind of leads into my last question that we have before we close out. Is there any takeaways, or how can a shift in perspective help reduce stress? I know you've given some examples as you and Phoebe was chatting, but any other takeaways you want to add around that?
I'd just like to say that a shift in perspective, if you choose, will help you determine where you are not helpless. A shift in perspective will help you realize a fuller picture of all that is going on, and to value what's important to you, and to know that that matters and that you can take care of it. We've talked about so many things that are going on. I really want people to understand that sometimes you act a certain way that you don't want to act because there's just a historical habit
Mhm.
that maybe you decided something at 15 or 13 that is true, and it's just not translating well into your adult life. You might want to rethink that. Sometimes it's trauma. Sometimes there's something coming up and that you are responding to something that you really can't get at right now with words, but you know it's there because it's in your body. Other times there is a way for you to determine that you choose to not be trapped right now, and that you will choose to see this situation in some other way besides making you feel trapped.
Right.
I know that there are a lot of people going, but I am, because that's the boss over there. And I get that's true. But I mean, we can think about prisoners of war, we can think about Holocaust survivors, and that they had shifts they had to make.
Mhm.
We think about now, with social justice issues. Why don't Black people just give up? Oh, right, there's a reason. Part of it is historically we have not, but we have not because we see something bigger. We see a reason to keep trying to care for ourselves. And all Black people don't have the same definition of what it is we all working toward, but we're working towards something.
Right.
Was that helpful? Was that specific enough? And then I did
Yes.
the specific things of think about preferences versus expectations.
Yes.
That's a real simple, quick one. And where am I taking this personally? Because if I'm taking this personally, I am no longer trying to problem solve anything.
Right. And it only stresses you out even more.
It does. We did not get a chance to talk about the mind-body connection, because sometimes you have to calm the body down so the mind can think something different. And then, of course, sometimes you down-regulate your nervous system by thinking some things differently, because they work together.
I was doing some reading about the power of our breath to interrupt the physiological response to emotions that are very heightened, and how it can actually calm the nervous system to breathe in a certain pattern. And that is fascinating. and free once you learn.
Breathe. So I like what you said, that there's a certain pattern of breath. You breathe in and you hold it for a bit of time, and then you exhale. There's something about holding it and then exhaling that actually tells the body something. But you are not getting rid of the emotion. You are decreasing the intensity so it can be instructive, not overwhelming.
You brought up so many fascinating things, and as you said, it is so very informative, because this is, to have access to how we can shift our perspective, because it is so empowering. And that, I think, is part of the challenge that we face. Why stress overwhelms us so is, at least for me personally, we feel powerless to change certain things. And so this gives me access to the thought that maybe I don't have to change the thing. I just need to change how I'm perceiving it and changing the impact. And then to cultivate a greater degree of self-awareness, so that I can stop and ask myself the question, why is this impacting me this way?
Yes. Yes.
What is this relating to that? Okay, I may not be consciously aware of. Maybe I can get a little more access into, what's not right there on the surface, do a little introspection. And one of the things you mentioned is that, a certain having expectations makes us rigid, whereas our focus should really be on compassion and respect, not only for ourselves, but of course in our relationships with others, because then we will ask the right questions and seek insight as to what they may not be aware of is going on with them.
One of my team members says, you really can only care for, love, and respect another person to the extent you do those things for yourself. So
that's deep.
Yeah, and it is deep. She's deep, and it is important.
How does that help us with stress?
Well, you would want to first and foremost say, gosh, I'm stressed. This matters. Let me see what's happening here. Not, oh, I'm stressed and nobody cares. I got to keep doing this anyway. And I just have to keep grinding no matter what. That's probably not going to help as much as saying, what do I need right now? What do I need right now? And since we're all adults, what you need right at that moment, you might not be able to do, because it might be, I just need to go home. Maybe you can't do it right that minute, but you can say, what do I need? You can pay attention to what your body is telling you, where the stress is. Is it in your shoulders? Is your chest tight? Is your back hurting? Are you not breathing well? Where is this stress? And you stop and you just say, yep, thanks, body, for letting me know this. And then you brought this up. Now you take some deep breaths, because that's the thing you can do immediately. You breathe in for a count of, I think you breathe in for a count of 4, maybe hold it for a count of 5 or 6, and breathe out for a count of 8. Like you breathe out longer than you breathe in. And you do that at least 3 times. And you're paying attention to your body so that you can understand that some of the things are loosening up. So the very first thing you can do is, what do I need? What do I need right now? And then get that as best you can. A lot of people forget to keep paying attention 360. So I breathe in, I breathe out. Okay, I'm gonna go. Okay, and pay attention. Did it go better when you got back in after the breathing? Did it? Yes. Did it? No. What did you learn? Because the thing is, what did I learn? Americans really want immediateness. Let me fix this immediately. Swallow this pill. I'm gonna be perfectly okay. And that's really not the way
how humans work.
That's not how humans work, and it's certainly not a way to build durable joy in your life. So pay attention. What if that made a difference? And do you want to do it that exact same way, like in the next 45 minutes when somebody pisses you off again? Or do you want to try to do something a little bit differently? Because the point is, how can I take really good care of me? Especially in the South, we are taught, from a Christian perspective, sort of that's selfish, or that you shouldn't be taking care of yourself. And that's not, I'm not saying be selfish.
Love your neighbor as yourself, though, right?
So if you want to love your neighbor really good, maybe you should start taking care of self, because that's what I just said earlier. You can't love somebody better than you can love yourself. So
Yeah.
that's the first thing. What do I need? And recognize that nobody does it correctly every single time anyway. Also, we are talking about managing stress, not eliminating stress. So have a appropriate expectation. Some amount of tension is important. It keeps you moving forward.
So,
Stress and challenge are very close. One person's stress is another person's challenge. And sometimes your stress turns into a challenge when you shift your perspective or your perception about what's in front of you to do. So
don't expect expectation to be stress-free, because that's not realistic. But if you make it a
I don't know. I think
preference,
those people, those guru people who like meditate for 12 years at a time, that's kind of stress-free. Otherwise, I don't think the rest of us really are gonna get there.
so we really want to define our preference for how we reduce the stress coping mechanism. Something I was listening to recently was the importance of the taking care of yourself physically in order also to have the right perspective and the ability to be more resilient when it comes to stress. A simple thing like drinking enough water, because the brain needs it, proper sleep, nutrition, knowing what foods help the brain to function optimally. What are your thoughts on that? Movement.
It's not just the brain. I mean, it is certainly the brain, but I have to tell all my students, like, I know
We're a whole body. Yeah.
Right. We have our mind. Our mind is where everything happens. Our mind is where everything happens. So when someone says, "Oh, that's just all in your mind," well, of course it's all in my mind. Where else could it be? That's how I perceive the world. So first of all, your mind, and your mind is housed in your brain, right? Sort of. We could go with that. And your brain is specifically and irrevocably connected to the rest of your body. So it's bi-directional, both. So sleep, getting proper sleep means getting all of the stages of sleep, because you don't need just quick sleep. You have to have restorative sleep. You have to have a sleep where your body kind of slows down. You have to have a sleep where you have that rapid eye movement, REM, where you're dreaming and working stuff out. Then you also have to have that deep alpha or beta wave, whichever one, sleep, where your body is also doing restorative things. All of those stages more than once, because your brain is cleaning out, it doesn't ever really throw anything out, but it packs up. Okay, this stuff goes up in the attic. We don't need this. We can keep this catalog. Let's wait. Okay, so that you can think better. Nutrition wise determines how well everything works in your body, how your muscles do, how the gut manages to do what it's supposed to do.
The second brain.
You have all the building blocks for that. Exercise is really important, because I mean, this is not my area of expertise, but I think the body was originally designed to move. It was not designed to work optimally, not moving at all. And so if the body can't do what it's supposed to do, it does affect the brain, and vice versa. And there's ways to get around. I'm not talking about how much movement, but there's that. So all of these things are necessary and required, but when you start caring about yourself and having some compassion for you, then you would want to take better care of yourself. And again, our body keeps all of our experiences, so it may be a really hard day, and what it is that is good for you is, a serious container of, what's this, salted caramel ice cream. Okay, so you do that for yourself, because food is, you really can't withdraw off of food. So it's always got a double-edged sword, but things in moderation or as you need them. is really important. So if you're trying to lose weight, I can't eat that, I can't eat that. Yeah, that's another abusive thing to do. Maybe you can't eat that, but where your attention can go is, but what can I do? Because I don't want to feel trapped. I don't need to be in the prison. What can I do? For what's
Don't be rigid. Don't be
what's
rigid.
best for you, like the 4 agreements, do your best is defined at each moment. Because what's my best in terms of eating is probably different tonight than it would have been 2 nights ago, or maybe 3 months from now. That is a thing that is a concern for me now that we have such a huge emphasis on mental health. We got to get everybody mentally well. We need to figure out what that is. Let me get one definition. Let's work toward that.
That's a concern.
That's a concern because it suggests that there's a way to approach mental health that is right for everybody, which means that if you're not doing it that way, then maybe you're doing it wrong. It separates you from understanding what is best for me. So what we have in the year 2023 is lots of ways to approach being well. Some people can put way more emphasis on nutrition and sleep, which works. Other people may put more emphasis on, let me do this talk therapy thing and work out my trauma, and maybe I'll try to sleep better. It works. Other people know this exercise over here, I have to do this because there are endorphins, there are things that happen. So what I'm saying is that it's probably not best to only have one approach, nutrition or this or that, because as people who study the body, it works in balance. It works in homeostasis. Everything has to kind of work together.
Yeah, we can't separate out this piece from that piece, and we're a whole being, and so you have to feed your whole beingness.
But everybody doesn't need the same kind of nutrition, the same kind of way, and the same amounts at the same time.
Yeah. I mean, even when you focus on women's health, a teenage woman as opposed to a premenopausal woman, as opposed to a postmenopausal woman.
I was just about to say, and once you figure out something when you're in your 20s or 30s, then, oh my goodness, now I got to figure it out all over again. And my
yeah.
Which is how it's supposed to be. You didn't make a mistake.
And something I was listening to the other day about when it comes to mental health and depression, so many young people are experiencing it because of the influence of digital devices and the constant firing and release of dopamine that actually results in a dopamine depletion. So when you were talking about rest, we need to rest sometimes from the constant stimuli that the digital access has created,
Right.
because
you need the balance of connecting and being energized or up with downtime and time to process and put things together. And different people need different amounts of downtime. I do believe that this information that we have in the media about how social media affects the brain is true, but I'm fairly certain it's not the full picture. I'm fairly certain that there are young people and maybe not so young people who are managing this well and doing it well. I'm also fairly certain that those of us who did not grow up with constant media presence and ability would not really fully be able to understand what it means to be healthy with media now, because it's a different world. And what we need to do is, again, learn how to expand our definitions of things so that what I think is healthy and appropriate behavior and the way people show up for my 15-year-old grandson might not be. Even if maybe he does need to change something, but it might not be that he needs to look the way I think he should look. And how difficult is that for us to say as the adults in the room, so to speak? So we do know some things about human beings, and a constant diet of social media is not healthy. And there are many millennials and Gen Z people who also say that too. Like, this is not healthy. They are clear about that.
Contributes to stress.
Excuse me. It leads to
Contributes to stress.
I think they may it leads to a distress. It sometimes leads to more of a sense of either not being connected or feeling not in enough control of what you are connected to. I've heard them say that this is just way too much of a negative thing, or I'll fall down the rabbit hole and I can, forget me. So that they clearly get, this is not good. I hear many millennials and Gen Z people going, okay, so I'm on a social media cleanse, or I'm not doing what they don't do Facebook. I'm not doing Twitter as much. And I got, pulling some things back on Instagram, or I need to make sure I stay off of it some. But also for the younger ones who are not doing well with social media, they're harming themselves, because they're going in this rabbit hole. But it's not like the rest of us don't have what's the equivalent to that. It's just not looking like social media. So again, we need to know what the facts and data are about how all these things affect a human being. But then you have to put it together like a crossword puzzle or a horoscope or something. Okay, here's a little bit of this, here's this, we know that, we know this, put this all together. There's an intergenerational trauma here. Here's what this means. There's our automatic thoughts, and see, okay, so what's the full picture for this individual? And we have a right and a responsibility to do that. So there's some things, all human beings need to breathe air. We need to eat food. We know that there's some things we need interaction, we need respect, we need safety, we need care, we need those things. But I am increasingly concerned with people who need to present the answer, because I think that's disrespectful to each and every. You don't know me. You don't know what my answer is. Even my physicians, who have give me lab values with my mixed connective tissue disease or the synthroid thing, you're like, okay, I get that's what the lab values say. Yes, ma'am. However, now we have to have a conversation about my subjective experience on these lab at this particular lab value, and whether or not I want to keep doing that. You're supposed to tell me, doctor, does that mean, okay, so if I'm too hypo, then I have cholesterol. Okay, great, thank you. And I need to count that person as the expert on the data that they have. But they're not the expert on me or my life, or even what I want to have happen. They don't know that. And as a therapist, I'm the expert on how human beings generally work and what the techniques are, CBT, or my 4 agreements. I get shift in perspective. But what I don't know is who that person is in front of me and what is going to be their optimal life, because they are the expert on who they are, how they're feeling, and what it is that they actually will want to live in. It's always supposed to be collaborative. So I worry about people trying to monetize an answer. That's how we got this to the place with our medical approaches. Monetizing caring for human bodies isn't working out as well as we thought. And many physicians are saying that they're getting creamed. So yes, there are very many things that impact a person's wellness. And today we talked about perception shifts. And I think it's very valid. I've been doing it for a really long time, so I think it's really valid. I will not ever say, however, that that's all you need to know. Well, that's the main thing you need to know. Or that's the only thing you need to know. When people say stuff like that to me, I don't trust them anymore. What? What do you mean? How do you know what I need to know? I can tell you, I'm an opinionated person. This is what I know is true. But I'm going to allow for the fact that now who I'm talking to now has a decision to make. about how much of that you'll listen to, how much of that you need from me about this, and how much you want to trust me.
Compassion and respect.
Absolutely. I think that respect really is an umbrella for almost everything. You can the kind of respect I'm talking about. You respect a person that you can trust. You respect a person that you know is respecting you. You respect a person who has proven their respect of you.
And we're up on the hour, so we want to respect your time.
Okay.
This has been amazing. And see, that's one of the things that I wish we had time to talk about is how the mindset, because really it is a mindset that you shared with us, helps us in our work.
Yes.
Helps the institutions
That
we
may
work
be a
with.
future recording.
Yes.
Future
You could do
recording.
that. Yeah, and I'm always concerned. I'm gonna have to work on my own automatic thoughts, because what I'm thinking is, oh, Shawn, you always did way too much talking. You didn't ask what they wanted to know. Somebody's gonna walk away from this webinar going, she didn't tell me anything. So I do struggle with that.
Oh, that's not the case, though. Rest assured.
Specific reasons why they may have come to listen. I would be happy again to talk about what that would look like in the workplace. I will say that it would be good, like you tried to do, I know y'all tried to do it, specific questions and specific scenarios so that we can talk about things that would be helpful. And I do also think that in person is better.
Oh, that would be fabulous. Fabulous. But we're so grateful for this time that you spent with us.
This was fun. I was so nervous, but this was so great. So it works better when I have somebody to talk to. So this is great.